Thank you. And now Andreas Ullrich, Switzerland. He will speak of the WHO view on pediatric cancer. Welcome.
Thank you very much. Ladies and gentlemen, it's a dear President of the Congress, dear representative of the Ministry of Health of the Russian Federation, dear panel members, ladies and gentlemen, it's a great pleasure for me to be invited to this important Congress and to have the opportunity to show you a little bit about how WHO can support this important global movement of oncologists together with NGOs, governmental and non-governmental organizations to fight against childhood cancer. WHO is a global organization of health to keep healthy populations and to provide support to countries to deal with the ill. And childhood cancer is a priority for WHO. We know that we have a substantial burden globally. We don't know exactly the number of cases, but we approximately estimate the number of cases every year to 230,000 children and adolescents having cancer and 100,000 deaths. So it's a substantial public health burden which we need to address. And I have this interesting slide because it covers exactly the area of this Congress. If you look at the areas of Asia, South Central Asia, this is in yellow, and Western Asia, together with Southeastern and Eastern Asia, together, if you add these percentages of the global burden, this Congress is covering 50% of the global burden of childhood cancer. So this convening power of this Congress is important because you have to deal with the half of the world burden of cancer. What is interesting for WHO in terms of what is our guiding principle is gaps in access to care and inequalities in access to care. And we need to address this. This is our guiding principle. And we have with childhood cancer a case, as we have in other areas, a very tremendous case of inequalities in treatment outcome between high-income countries or countries which have adopted and developed over decades a system, a care delivery system, and other countries which are in process to develop such similar systems. But for now, there is a big gap between the world of low and middle income countries which are facing the majority of cases and the countries which have more or less what we need. So late diagnosis is one reason, and no access or inadequate access to treatment is another reason for this inequality in outcome. And if we look a little bit more in detail, what are the problems? What are the gaps? This slide gives you a first, let's say, framework how to look at it. It's important to frame it in across 6 building blocks, which are the generic framework of WHO to address health system strengthening questions. Service delivery are a major problem when health care facilities, infrastructure is not organized according to the distribution of the cases in the population. One of the major problems in this context are disruption of treatment. We have found this in the discussions and literature review. It's one of the major problems in this area where health care delivery systems are not organized in that way that the access is for everybody accessible. Human workforce, healthcare workforce is a problem which you address with this Congress, which are addressed by UICC with training, fellowship programs. We have various methods to improve the knowledge and the skills of the healthcare providers, the doctors, the nurses, and the social workers. We all are needed in the treatment team for adequate care. Health information system. I already mentioned that we don't have an exact number for the cases, the new cases and the mortality. So we need, in countries where there is not yet an existing cancer registry system, we need a lot of investment to know more about the data, the type of cancer, the survival, and the mortality. And our research agency of WHO, which is based in Lyon, France, and my colleague Eva is representing this agency, very happy that you are here, is very much focused on cancer registration, providing guidance, providing the data, and we very much rely on IAC, International Agency for Research on Cancer, to get a picture of the global burden of childhood cancer and adult cancer. This is very important. Also the tools how to develop a cancer registry. Limited access is also very frequent, and we had this discussion just now in the session of CCI about availability of essential medicines or medicines in general, which we know they are effective, but they're not all available, or the poor quality, and these are issues to be addressed by the SIOP, by CCI, by the governments, by the global community on childhood cancer. Financing, you know, probably you are aware of the discussion we have at WHO about universal health coverage. It is important that countries develop financing systems to cover the care for children with cancer, and that it's not up to the parents to pay for the treatment and to fall into poverty. This is a fundamental principle of strengthening health system, is to think about a sustainable financing system. And all together needs to be managed by a coordinating team, best positioned in the Ministry of Health, and I'm very impressed, my colleague from the Ministry of Health of the Russian Federation, to talk about how the Ministry of Health is taking it very serious to improve the care of the population, of the whole population in Russia, by developing infrastructure, training, and medicines. So we have at WHO a global health policy on non-communicable diseases, which is the product of a UN resolution, a United Nations resolution on non-communicable diseases in 2011. We have an action plan on non-communicable diseases, and non-communicable diseases is an amalgam of many, many chronic conditions, including cancer and including childhood cancer. So it's important to see that your community of childhood cancer is part of a bigger picture, which we call non-communicable diseases. And the non-communicable diseases are part of the new Sustainable Development Goals. The Sustainable Development Goals is an UN-wide effort to develop, to help social development globally and economic development. And one component with goal number 3 is health. And the health component includes non-communicable diseases. So it's a very high level goal to improve childhood cancer care. We talk a lot about tertiary care and specialized centers, but we need to think about the full continuum, which is from primary health care, the detection of children as early as possible, to have a timely referral, to have an adequate treatment which is not too far from the residence, where the people live. And we need to keep in mind that not all cancer patients, not all children with cancer can be treated, so we need palliative care. We need a strong palliative care component within the continuum. So the WHO strategy for control of childhood cancer encompasses the 4 components of the continuum and the 6 building blocks to strengthen health systems in order to deliver care in an adequate way and to bridge the gaps which are still existing. We have WHO works with our research agency, International Agency for Research on Cancer in Lyon, which provides the evidence, and we translate it into practice. We collaborate with the NGOs, with the professional organizations, SIOP, CCI, UICC, St. Jude, and WHO as the convening power at global, at regional, and at national level are able to catalyze changes through this easy access to the governments. Our role is to advise governments on what to set as priorities in health priorities in the country, and we can do this jointly to frame it according to the needs of population. And one nice example how we all work together on a very specific project are two recent workshops. One workshop in Myanmar on a national scale and a workshop on a regional center in Ethiopia, and you see the pictures from 3 weeks ago. So where we can together with the national office of WHO, with the regional office and headquarters, together with our partner organizations, to develop capacity, to further develop capacity, to raise awareness, and to really achieve closing the gap. So in summary, childhood cancer control is an obligation to act. You have the various references to UN and WHO resolutions. And what is needed is a comprehensive approach, an investment from prevention, which is not, it's for cancer, but in childhood cancer from early detection, referral to palliative care. We are not promoting vertical disease programs. This is a very important message from me. We are promoting health system strengthening where childhood cancer NCDs are included and are adapted to delivery care. And the third pillar of making progress is partnership development. I thank you very much for your attention.